A manual wheelchair is a mobility device propelled by the user, pushed by the caregiver, or both. Manual wheelchairs come in various styles, including ultralight, lightweight, standard, tilt in space, and transport chairs. Their features and personalized setup have a significant impact on shoulder health, independent mobility, posture and pressure distribution, safety during transfers, and efficiency during daily tasks. Users may rely on a manual wheelchair full-time or part-time, depending on their mobility needs, energy levels, strength, medical conditions, or safety considerations. Here are some tips for transferring into a manual wheelchair. Once seated in the wheelchair, check the seat position. Hips should be all the way back in the seat, spine aligned with the backrest, and knees and ankles supported comfortably with foot plates at a comfortable height. Typically, there should be 1 to 2 inches of space between the back of the knee and the seat cushion to avoid excess pressure in that area. The feet should be fully resting on the foot plates, creating comfortable and equal pressure distribution when possible. Check the seat cushion and posture supports if applicable. Make sure the cushion is positioned correctly and adjust lateral supports, pelvic belts, or chest straps if the chair has them. The zipper should be positioned toward the back of the seat cushion. The alignment of the front wheels, also known as the caster wheels, plays an important role in wheelchair stability during transfers. Before transferring, position the wheelchair so the front casters are facing forward and not pointed away from the transfer surface. This may require a light repositioning of the wheelchair before the transfer. For user fit, posture, or comfort issues, contact your equipment clinic for an in-person assessment by your equipment clinic physical or occupational therapist. This includes seating discomfort or new pain, cushion not providing exact support, leaning or sliding or posture changes, fatigue or decreased tolerance for sitting, skin concerns or pressure injuries, recent surgery or medical changes impacting positioning. Your therapist can assess the user in the seating system and determine whether modifications or new equipment are needed. For mechanical or hardware issues, contact the company who supplied the equipment. This includes loose or missing hardware, wheel locks not working, tires not holding air, caster issues, broken armrests or footrests, or back canes. Vendors can often fix these issues faster than waiting for a clinic appointment, and many repairs are covered under warranty. Wear and tear is expected with use over time, so it's important to check your chair regularly. Rattling or shaking is a sign that maintenance is needed. Wobbling, fluttering, or pulling to one side may indicate caster wear, loose hardware, or alignment issues. Pneumatic, air-filled tires require routine inflation, so watch for any changes in tire pressure, as low air pressure increases rolling resistance and shoulder strain. Consider reflective tape, lights, or high visibility gear when traveling outdoors or in low visibility conditions. Check your wheelchair daily for issues before leaving home. Keep an emergency repair kit including Allen keys, a small wrench, tire pump, and patch kit if appropriate. When in doubt, you can always contact your equipment clinic and they will help direct you to either a therapist or the vendor depending on the issue.